This podcast is brought to you by North Carolina's electric cooperatives.
This is NC Spin, an unrehearsed discussion on issues of interest to North Carolinians. Now, here is your moderator, Tom Campbell.
Thank you for tuning in this week's NC Spin. There's lots of shiny packages to unwrap this week, beginning with the modified stay-at-home orders that start this weekend. We also open the box to the realization that our state has accumulated some $4.5 billion of unappropriated funds, and we discuss how we should spend it. Plus, we ask the panel to tell us something we don't know. Our panel this week includes Rufus Edmondson, former Secretary of State and former Attorney General, John Hood, syndicated columnist and author, Peg OConnell, political analyst, and Chris Fitzsimon, director of the state's Newsroom. We'll begin our uninterrupted discussions after these brief messages from our underwriters.
Farmville, steeped in Eastern Carolina tradition, yet surprisingly sophisticated. In Farmville, find a French bakery, a furniture school, glass blowing, great shops, and restaurants. East of I-95, in the middle of everything, find it first in Farmville.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Your life is more flexible and efficient than ever, and your energy is too. See how North Carolina's electric cooperatives are building a brighter future for the rural communities we serve at ncelectriccooperatives.com/brighter.
Let's begin the spin. Historically, if a naval vessel fires a shot across the bow of another vessel, it's considered a warning to stop or alter its course in order to avoid negative consequences. There's no question Governor Cooper fired a warning shot to the people of our state this week by issuing a modified stay-at-home order after 48 counties were considered in the red zone, 34 in the orange, and 18 designated yellow. Restaurants, bars, and other venues are to close by 10 p.m. each night. People are to stay home from 10 to 5. The next day, we've been interested in following the responses that came from this announcement. North Carolinians have ranged from, why did it take him so long, or why didn't you do more, to those who complain that once again Cooper is trying to ruin the economy and control their lives. Peg OConnell, what's your reaction to the governor's new modified stay-at-home order?
I think the governor has done a pretty reasonable job of trying to balance the public health need with the need to continue economic activity. You know, coronavirus right now is our number one public health issue, but poverty and homelessness and hunger are also huge public health issues. So we've got to do a balancing act. And right now, I think this is as good as it can get if people will just abide by the new rules.
John, how big a deal is this really? Because restaurants can still serve takeout meals after 10 o'clock. The main thing it looks like he was trying to do is keep people from congregating and drinking alcohol.
Yes, congregating, drinking alcohol late at night, and then perhaps not taking as much precaution as far as spacing themselves, wearing masks, being outside if possible. So I think that is correct. And I think Peg is onto something here that I think the governor was trying to avoid going the places that some states have gone, actually shutting down restaurants, for example, which has lots of implications for jobs and so forth, particularly during the holiday season. But at the same time, trying to break up large congregations of people acting irresponsibly, which arguably this will do, though there is some concern about whether it will really be effective. Will people simply, instead of staying at bars until late in the evening, will they just go to create house parties and do other things? There is a limit to how much government can regulate people's behavior, because we're not going to enforce these things rigidly with, fining people and arresting people. So a lot of this is signaling that people should take the virus seriously, which of course they should.
Rufus, Massachusetts and Ohio have attempted similar types of modified stay-at-home types of effects. Massachusetts, it had a little bit of an effect for a while, but now the numbers are creeping back up. Ohio said it didn't particularly have a whole lot of effect at all. John's put his finger on the real issue here, and that is enforcement. And most of the local law enforcement people and local officials have said they don't intend to enforce this. So what have we done?
Well, I like my grandmother would have said, you got no business being out. You're up to no good if you're out after 10 o'clock anyway at nighttime. And I don't know really what that particular thing does in the way of curbing any kind of thing except what John and Peg said of congregates, people getting together and raising Cain late at night, which is seemingly what I used to do, but not anymore, of course. We don't do that anymore. And I'm not so sure that you have any empirical evidence that curfews do anything, but at least Cooper is trying, as Peg says, and he's trying to cut down the middle and do things to keep us open. But he is saying to us that, look, behave yourselves. That, you know, none of that, we wouldn't be talking about this if people would just behave themselves, and they won't do it. Yeah. I don't get that. The rules of norm I went the other day to a store and I saw someone without a mask and he was arguing with the storekeeper about, I got my personal freedom. You don't have your personal freedom when you're infecting other people.
Yeah, you don't have a personal freedom to infect me. Chris, I interviewed Secretary Cohen on TV Wednesday night, and I got to tell you, she was afraid. She says this thing's out of control, and we haven't even seen the Thanksgiving spread that's going to come from it. And she said, one thing that she said that really struck me is we've had more deaths resulting from COVID-19 than we've had in the last 10 years so far as the flu is concerned. Doesn't that kind of refute all this noise we're hearing from people saying, well, we don't need to really be afraid of this. It's not that serious?
Of course it does. And the CDC director said yesterday that he thought we would have more than 3,000 deaths a day in the United States for the next 6 weeks. Think about that, how many people that is that are going to die in the United States. And I think you did leave something out. You said, what's the point if we can't enforce it? Well, part of the problem is we still have political leaders who are saying that it's no worse than the flu. We still have the Republican Party having an inside party not wearing masks. Ironically, we found out about that at the same time we're all trying to figure out what the governor should do to stop people from dying. We have record hospitalization rates. We still have a culture where more than half of our political leaders are not standing up and joining hands and applauding these efforts and telling people to stay safe. When's the last time you heard a statewide elected Republican official in North Carolina say, don't go into inside restaurants, get takeout, wear a mask? Instead, they're having parties, and we sort of keep glossing over the fact that this has become a partisan issue, and one side of the partisan divide either doesn't believe or doesn't care about the virus.
Peg, Chris, you raised a good point. Peg, last week we heard about the School Superintendents Association of North Carolina that had a big event from which several of the superintendents came down. The Republican Party in North Carolina has had several events over the last. Here's my question. If our leaders, people who are in positions of authority, are not willing to follow the guidelines, how in the world can we expect the average Joe and Jane on the street to do it?
Well, you know, Tom, I think in many ways, and all the issues I've worked with in my public health advocacy career, the people of our state are usually ahead of their elected leaders. So, you know, I think that if we keep getting the messages out, that people will comply. And I don't think it's an issue of enforcement. I think it's an issue of compliance. And as soon as someone in the family gets sick, that makes a whole different message. But one thing I do want to say is during the pandemic of 18 and 19, we lost 750,000 Americans. And we thought, that'll never happen during this pandemic. If something doesn't change, we are on target to blow past that number.
Yeah, you're absolutely correct. John mentioned, Chris mentioned the fact that the number of people in hospitals as a result of COVID has doubled over the last month, some 2,300 or something like 1,300, whatever it is. Two researchers at Duke and UNC put out a report saying that at the rate this thing is going, we're going to run out of hospital beds in 6 weeks. Not only hospital beds, but the doctors and the caregivers that are needed for it. The CEO of Vidant Hospital, Rufus, said that this was a hard time we're in and a very real possibility, and even mentioned the fact that we might get into a situation of care rationing. Golly, choosing who gets taken, who gets care, who doesn't get care. That's scary, isn't it, Rufus?
Well, in a sense, we're doing that now, because when you fill up these beds with COVID, the people that need hospitalization for other things, heart attacks, breathing problems that are not related to COVID, they are rationed already. And there's no doubt about it, there's going to be a rationing, and we're going to have a severe other health problems. And what I worry about is I have a number of people in my family who are nurses and healthcare workers. They are worn out.
Yes.
They're plumb smack dab worn out. And they've got to get some relief if people would just behave themselves.
There is some good news in all of this, John. Thursday, the Food and Drug Administration gave emergency authorization for the Pfizer vaccine to be distributed and inoculate people. But over the past couple of weeks, we've seen some very interesting information in North Carolina. The High Point University poll said only 42% were willing to take the vaccine if it was available to them. And Elon released a poll this week that pretty much corresponded with that, saying 40.5% were willing to take a shot. Why all the skepticism? What's all this about?
It's a combination of factors. The skepticism isn't just limited to one side or the other, or one group or the other. There's skepticism in across the board.
Yes.
But at the same time, it's important to remember some of the people who say they won't currently take the vaccine, they're not actually anti-vaxxers. Many of them say that they want somebody else to take it first. Essentially, they want to see some sort of proof in the real world of safety. I think that's overly skeptical, but I also think that means that they are probably going to come on board. The initial wave of vaccinations, which are already starting now, are going to be of people who are frontline healthcare workers that Rufus was talking about, people who are highly vulnerable to complications and death from COVID. And so when we get to the general public, it will still be weeks or months from now, and I think that number will go up. But we shouldn't leave it to chance. We should be clearly messaging Democrats, Republicans, old, young, white, black, brown, everybody, addressing their concerns about vaccinations in general and this vaccine in particular, explaining, as Dr. Cohen did the other day, that this vaccine is not weak versions of the virus that might kill you. This is a completely different, in fact, all three vaccines that are coming down the pike, which will be useful, do not pose the kind of threat that old school vaccines may have once posed. So I think we've got to convince people, persuade people, just like we were talking about with precautions. I think talk of forcing people to take a vaccine is actually counterproductive.
Yes.
It makes people's hair go up on the back of their necks, and that's probably not a good idea. But I think through persuasion and explanation, we can get there.
And as time goes on, this Elon poll, Chris, had some other interesting information. They said 68% of the people they surveyed trusted Governor Cooper's handling of the pandemic. However, only 56% trust the Food and Drug Administration. Have we become a skeptical, untrusting group of people?
Well, we do have folks who are still, everybody has problems with the way sometimes our institutions work, but I do think we're in an era where we're encouraged not to have faith in big institutions, even some that I believe deserve our faith and our trust. I think it's a scary statistic. We're living in a scary time when people aren't sure what to believe.
Tom, let's face it, we've not had very great national leadership on this. When it came, it was ignored in the beginning. It was going to pass away. It would fade into the night, and that is not conducive to people taking vaccines to protect themselves.
Only 47% said they trusted President Trump with this. Rufus, I want to ask you this. You served on the Council of State for a large number of years. Outgoing Labor Commissioner Cherie Berry said this week the virus was not an occupational hazard. And so, therefore, her department would not impose additional regulations to require employers to work to protect workers. What do you think of that?
That's a strange one, Tom. Of all the places, think of the meat processing workers. Some of the greatest outbreaks have been in the meat processing plants. And that is occupational workers. Who cannot say that that is not something you should protect very vigorously? With all due respect to Cherie Berry, I don't know where she's coming from, and she has sure stirred up a hornet's nest, because anybody can look at that and see that she is just dead wrong.
Somebody said the elevator lady should go get on an elevator and leave this alone.
Well,
let's move on.
Bless her heart.
Yeah, bless her heart. That's a good one. During this Christmas season, we're reminded of the many who are homeless, hungry, and hurting, and many of us want to help our fellow citizens. This year is especially difficult, which makes the report that was released this week by our state controller relevant and interesting. As of the end of October, state government has more than $4 billion, that's with a B, $billion in unspent revenues, and the total is growing every month. Additionally, we learn we've got some $3.6 billion of CARES Act relief funds that got to be spent by the end of the month or returned to the federal government. We're told most of the CARES Act money is allocated. It appears that we've got at least $4.5 billion total unspent. Rufus, the reasonable question here is, why is our state government not doing more to help unemployed? Why isn't the legislature meeting?
Well, that's a great question. Now, some of the CARES money has been allocated here just in the past couple of days to broadband, which I think was a wise idea. But very few of us, I don't think, on this panel have ever known when we didn't have enough food to put on the table. We probably never worried about whether to pay the rent or not. And I am very concerned about restaurant workers and the restaurant owners. They have had to take the brunt of this whole thing time and time again, and it's a very viable portion of our economy, and it's just going down the hill. And I don't know why they're not in session right now saying, okay, let's get this up and going.
Yeah.
What can we do to help?
Yeah, John, one of the reasons why we've accumulated such a large sum of money, and we've got to give some kudos here to our legislature, they've been pretty frugal with funds, and they've accumulated what's called a rainy day fund, and that's a large part of this, plus unallocated, unappropriated surpluses that we've got in state government. Part of the reason for all of this, however, is because we're still operating on a 2018 budget, because neither the legislature nor the governor could get together to pass a budget. What message do we need to be sending both of these parties?
Well, the legislature is coming into session again next month. And keep in mind, the rainy day fund is on top of the money you're talking about. The rainy day fund, a little over $1 billion. If you added that to the unreserved credit balance, we're talking well over $5 billion in available funds. Now, part of what's going on here is that legislators in both parties and the governor were all worried that there would be a huge hole in the state budget, funding prisons, funding schools, funding universities, because revenues would crash. Revenues really didn't crash. And so that some of this precaution, some of this not spending the money yet, is because they were trying to wait and see when they get into early 2021 what they needed to do to balance a budget. It turns out they don't need to take heroic efforts to balance a budget. So I suspect there will be, when the legislature convenes, and Governor Cooper, who was hoping against hope that the Democratic Party would take over one or both houses of the General Assembly. That didn't happen. Well, now he's facing an obvious situation where he's got to give.
With
the
all
Republicans
due respect,
have to give, and I think there will be some compromises coming.
Yeah, with all due respect, why wait a month? I mean, we could have been doing something about this. I mean, we've got these money set aside for a rainy day. Peg, isn't this a rainy day?
This is about as rainy as it's going to get. And I got to say, there's an element of Ebenezer Scrooge in all this, to leave that money sitting there when we have working people who are in need. I just think it's disgraceful. I also think that some of that money needs to be invested in our public health infrastructure. If we had had some more robust public health infrastructure at the county and local level, a lot of the virus spread and the early surveillance would would have been better, and we might have been able to get in front of this.
Chris, some of the numbers that I'm hearing are 250,000 North Carolinians have lost their job-related health insurance coverage. We've got as many as 100,000 people that are going to be facing eviction in January. 1 in 5 people, according to Feeding America, 1 in 5 people in our state is having food insecurity. Why hasn't the governor called a special session? Why aren't we doing something? That's my question.
Well, I don't know, and I agree with you. And why hasn't the legislature called themselves back? Why hasn't Phil Berger and Tim Moore called the governor and said, let's work together and figure out how to do this? I mean, here's the thing. I understand your frustration, Tom. We have that money sitting in the bank. Nobody wants to spend every dollar of it. We just talked about the restaurant industry. We talked about all these industries hurting in North Carolina. People don't have their jobs anymore. We have a short window of 3-4 months, maybe at the most. We have this money in the bank. Surely there would have been a way, and there still is a way, to figure out how to give aid to those small businesses and those people on a one-time basis until this economy recovers. And the economy's not going to fully recover until the virus is gone and behind us, or at least mostly, and most people have been vaccinated. Now we have a short time frame. We have this money. I think it's unconscionable not to be working on a plan yesterday, to help people and small businesses who are in need while we get through this pandemic.
The message we're basically sending to the people of North Carolina is you're on your own. Isn't that right, John?
No, we spend lots of money. We have unemployment insurance payments. I agree that some of these things,
the lowest
like public health
in the South.
No, that's you're talking about comparisons. That has to do not just with the size of the check, but the amount of weeks. So it's not the size of the check that's lowest in the Southeast. But anyway, the legislature should take action. The governor should take action. I agree with all that. Particularly, the public health infrastructure needs funding. But remember, not that long ago, just like 2 or 3 months ago, actually 1 month ago, there was still concern that we would end up having to lay off teachers, lay off public officials, lay off people in universities. There were all these concerns about the fundamental structure of government was going to be hit hard. The evidence, it was wise to wait and see what the numbers look like. Now it doesn't look like that's the case. And now we have this money saved that instead of having to cover a multi-billion-dollar budget hole, which is the kind of thing most of the other states of the country, or many states, are facing, we're not, because of wise decisions. And now we can make these other investments. I think that's right.
That's a point well taken. I think what you had to say was certainly appropriate insofar as waiting to see. But now we know. All right, let's get to the section of the program where we ask the panel to tell us something we don't know. Rufus Edmondson, I'm going to start with you.
Well, I want to tell you something that you should know, that how much I've enjoyed being on this program. I think it's done a great public service benefit to so many people. I thank you, Tom, for your patience with Rufus Edmondson. I thank all those people who have commented over the years that you should have fixed your hair better. I didn't like your tie and the handkerchief that you wore with it that day, but it's been a wonderful ride, and I'm very grateful to you and the staff here at UNC and at WRAL in the beginning. And it's been a great joy to be with all these panelists, and I hope that our paths cross many times in the future.
Oftentimes when somebody tells me something like they didn't like my tie or whatever like that, I'll say, didn't you notice that people were actually saying things on the show? Didn't you hear any of that? Peg O'Connell, tell us something we don't know.
Well, first of all, I was very glad to see that Farmville, North Carolina, the jewel of Pitt County, is an underwriter for NC Spin. And much like Rufus, I want to thank you, Tom, for the opportunity to do this for the last 11 years. And I have enjoyed it immensely. I've really enjoyed getting to know John and Chris better and all the other panelists. It's been a wonderful, wonderful opportunity for me. And nobody ever says that they didn't like my tie.
By the way, these two are making these comments because our last show is going to be December 25th. And this is the last opportunity they're going to have to be on the show. However, that's not true with John and Chris. So, John, tell us something we don't know.
Happy 85th birthday to James Grubbs Martin, born on this date in 1935, a former two-term governor of North Carolina. But his most important accomplishment was, of course, being a chemistry professor at Davidson College, really shaping the minds of future Davidson College graduates for many years.
And beating me for governor, John.
Yeah, well,
I wasn't going to mention that, Rufus, but now that you mention that.
Yeah, Jim Martin has always been sort of a humble, unassuming kind of guy, and history is going to show he was much better governor than people gave him initially credit for. And your book on Jim Martin, by the way, is one of my treasures I keep in my library permanently. Chris Fitzsimon, tell us something we don't know.
Yeah, I too will wait for any goodbyes or reminiscence about NC Spin until the next couple shows. But I think one of the biggest stories in America this week was that people, more than 100 members of Congress, are calling on an election to be overturned, even though the election has been certified in every state in America, all 50 states and the District of Columbia. 6 members of the North Carolina congressional delegation have literally joined a lawsuit asking for an election to be overturned and the votes of millions of Americans to be voided. This will go down in history, I think, in 10 or 20 years as one of the most outrageous weeks in the history of our democracy, and I don't think that's hyperbole.
We should mention the 6 names. I'm sorry I don't have them written down, but at any rate, there were 6 North Carolina congressmen that joined it.
Actually 7, because Mark
Mark
Walker said he was inadvertently left off the list.
I got to wrap this up. You've heard our spin on the issues of the day. To stay informed during the week, sign up for our email newsletter, give your feedback, and read my column. Be sure to visit ncspin.com or ncspin on Facebook. And until next week, stay informed and watch out for the spin.
Farmville, steeped in Eastern Carolina tradition, yet surprisingly sophisticated. In Farmville, find a French bakery, a furniture school, glass blowing, great shops, and restaurants. East of I-95, in the middle of everything, find it first in Farmville.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Your life is more flexible and efficient than ever, and your energy is too. See how North Carolina's electric cooperatives are building a brighter future for the rural communities we serve at ncelectriccooperatives.com/brighter.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC TV.